TMJ disorder treatment involves a visit to the dentist in the first instance to find out the particular cause as to why the patient is experiencing a disorder with the temporomandibular joint. The temporomandibular joint is made up of a joint between the upper jaw and the lower jaw and is made up of a cartilage joint inside. Around this joint are 4 large muscles that allow eating, or what we call mastication, to occur. If a patient suffers from pain related to abnormal function of this joint, this is called TMJ disorders. As a dentist, the first thing I will want to do is to examine you to make sure that there's no form of impediment to your range of movement of your jaw. In addition, I will also palpate by gently pressing all these 4 groups of muscles to ascertain if there's any pain. Some patients have limitation in the range of movement, and some of them also present with a locked jaw. In some instances, we will be able to feel some crepitus, which is as you open your mouth or close your mouth, some grinding or cracking sounds at times. When the CT scan or the X-rays are done, we will be able to ascertain whether you have anything wrong with the joint. Some of the examples of joint abnormalities will include 1. The presence of osteophytes. Small protrusions of bone in the area of the joint will cause pain as the patient opens or bites. In addition, we will be able to see pathology or problems associated with the head of the lower jaw. That's called the condyle. Further to this, sometimes we will also see the joint space has reduced in size. In terms of a disorder to be treated, we first need to understand the cause of this. Most of the time it's related to the muscles around the joint, which is causing this tension or pain. It is frequently accompanied with no radiographic abnormalities, which means the X-rays have just been done to exclude problems. To start off with, once a diagnosis is reached, we can then start with simple analgesia and some simple massage techniques. If you imagine having an arm that's gone to sleep after you've lied on it for a while, and where you would just shake your hand, you want to do exactly the same for the facial muscles because they're all in spasm. We can start to do more complex work like TENS treatment, TENS, where we put on these pads on your face and the current basically relaxes your muscles over 45 minutes. And this should be repeated at least once a week over a 4 to 5 week period of time. Now, other things like lasers, it takes about 20 minutes each application on either side, and treatment can be carried out every 3 to 4 days, and it's 3 to 4 weeks of treatment. Sometimes you may want to do some injections of the joint. The masseter, that particular muscle, is the primary closer of the jaw. Once reduced in strength, using a product such as Botox will reduce the intensity of the grinding, and that itself will prevent the jaw from feeling painful when the patient wakes up in the morning. Other treatments like the injection of local anesthesia, steroids, and hyaluronic acid. Sometimes we have to replace the fluid inside the joint. TMJ TENS treatment is used to relieve muscular spasms of the 4 muscles that surround the TMJ. The nurse will explain to you what the procedure is going to be like. You'll be sat in a quiet room. We will start by taking a measurement of the maximum opening your mouth can handle at that point of time. After treatment, we'll do another measurement again. The TENS treatment actually is very conservative in nature. There are no injections. Also, most of the patients tell us that there's almost instant relief of the pain. If you've had pain for quite a while, the TENS treatment is sometimes used to allow us to take a proper bite for you. So this is done in combination with complex aesthetic work or complex implant restorative work. And the results are once again very, very reproducible. TMJ disorders can also be managed by physiotherapists, and they're also traditional therapists. The primary modality of all of this is to release muscles that are in spasm by the use of trigger point release techniques. The second thing they do, of course, is the utility of heat. Heat can reduce the spasm that the muscle is in and reduce the form of pain that the patient is undergoing. We also work with 2 types of counselors. One is a behavioral counselor The person's a cognitive behavioral therapist who basically ascertains where stress might be coming from. The second counselor would be a wellness counselor. Studies have shown that things like breathing techniques, yoga and meditation can also improve the outcome for our TMJ patients. As a dentist, the thing that most dentists would do for the treatment of TMJ disorders is to make a mouth guard. At Nuffield, there is both a day guard and a night guard. The day guard I use for my patients is to check and inform them if they are clenching their teeth or grinding their teeth during the daytime. This mouth guard is thin, which allows you to speak, allows you to carry out your daily activities. The night guard that I make for you is thicker. And the reason for that is because I do not want to allow the muscles to contract at night. And the basis of this is that the muscles don't get a chance to overexert tension and thereby cause the pain that you feel in the morning. The ultimate goal is to prevent overloading of the joint and the muscles to relax so that the TMJ disorder is treated.